we were not prepared for the pandemic. And that is, that will not be the case in the future, but that was certainly the case now, that this has introduced a whole new level of what a crisis can look like.
So one of the things in trying to get ready for this and to start figuring out, because we realized very early on in this, we were going to have to shut down research. And most institutions went about reviewing their external awards and even internal awards, what everything that they had going on. Andrea, what process did you follow in looking at your awards and starting to prioritize how you were going to start those shutdowns?
So first and foremost, we looked at the safety of the individuals, and we started almost immediately because everyone was locked out without any regard for what experiments they may have in place, what research may be going on. And so what we did first was we worked through our deans, and we worked through our deans and said, you talk to your faculty, your chairs, your staff, you find out who needs to go in, and then you help us prioritize. You have a better idea of what's going on in your spaces. Then we did this in phases, right? We prioritized what was the most important. In the first phase, graduate students were not allowed back on campus. It was only faculty, only 500 feet. We could only have so many individuals per 500 feet. They had to have a safety plan. That safety plan had to be approved. And so it was quite rigorous in the first go round, as it should have been. But it took the dean's office, the VPR's office, facilities and maintenance office on campus to all work together on that. And we didn't approve very many at first because originally I think people thought this would be over fairly quickly. Some people did. And so they said, we just need 3 more days, and then this will help us with our next proposal. And so trying to weed out what's important to that individual against what is really important for the university and that research was extremely important. The next phase, we opened up and allowed graduate students. The graduate students had to sign something saying that they had not been coerced. Now, we all know that that's as good as the paper it's written on sometimes, but we did take that into consideration. We also, in the first wave, everyone who was coming back to campus had to be tested. In the second wave, we determined that everyone who was coming back had to be screened, not necessarily tested. And so then the third wave, we started allowing some undergraduate researchers. So that's kind of the way we looked at that. But it was a tremendous amount of work on the people who were screening these applications. And they really looked at it very carefully. And there were some people who weren't happy with the decision they received. And then we found out we had one college that they had been coming in the whole time and just didn't tell anyone. And so, it's really this balancing act of how you protect people when they aren't helpful in protecting themselves.